Hello, good day everyone. My name is Mary Suzanne Canila, your student nurse from Davao Doctors College, BSN 111L. So today I'm going to perform a return demonstration in thorax assessment. Reviews clients' previous medical records if available. Enables easy collection of information from the assessment as part of the study. Determine the scope of assessment needed, prepare necessary equipment to ensure organization and increase efficiency in performing the assessment. Perform hand washing to prevent infection and contamination. Greeted the client politely and client's companion if around. Introduce self and verify the client's identity. Ask how the client would like to be called during the assessment. Establish rapport with the client. To show courtesy and make the patient comfortable, also introducing yourself to the client enhances rapport. Good morning, ma'am. I am Mary Suzanne Canila, your student nurse for today. Can I have your list, ma'am? Okay, so please state your name and your birthday.
I am Anlongkin Kalimar and July 5, 2000.
Okay, so what do you want me to call you?
Just call me Queen.
Okay, so explain the procedure to the client how or she can participate during the assessment, provided the clients the opportunity to ask or clarify or raise any concern. To reduce the client's anxiety and enhances cooperation. Okay, so you can cooperate with me by moving specific parts of your body. So I've been reading or something or procedure. So if you have any clarification, I would like to be glad to assist you. Ensure clients' comfort, privacy, and confidentiality. Assessment setting was assured to be safe, secured, and form for the distraction. Position client to seated comfortably to ensure to keep personal information to the public and the setting be comfortable for the client. Yes, I assure you that all of this assessment is disclosed to the both of us for your privacy and to your information confidentiality. Now, check for signs of respiratory distress or problems with oxygenation. Observe color of face, lip, chest, and fingernails. Palpated supernatural sternal notch and noted the possession of the trachea. Can you inhale and exhale for me, Queen? Okay, so one more. Okay, now I'm going to observe the color of your lips and your face and chest as well as your fingernails. Okay, so now I want you to turn your head on the other side. Okay, the other side. Okay, thank you. Now let's inspect the configuration. While the client stands the arms at the side, stood behind the client, and observe the position of scapulae and the shape and the configuration of the chest wall. Refers to the overall structure of the chest. Is it okay, Queen, that I will be touching your chest?
Yes, nurse.
Okay. No, now turn around for more, please. Okay, thank you. So next, inspect the spinal alignment for deformities. From a lateral position, observe the three normal curvatures such as cervical, thoracic, and lumbar. Okay, Queen, can you look at me? Okay. So, to assess the lateral deviation of spine, scoliosis, observe the standing client from the rear, have the client bend forward at the waist, and observe from behind. to determine any abnormal curvature of the spine. So, Queen, I request you to bend like you are tying your shoelace. Okay, thank you. So now I'm going to palpate the posterior thorax, assess the temperature and integrity of all chest skin, palpated all thorax area for bulges, tenderness, or abnormal movement. So Queen, I'm going to touch your chest wall posterior thorax. Is that okay?
Yes, nurse.
Okay. So now palpated the posterior thorax for respiratory exertion. Place the palms of both your hands over from the lower thorax with your thumbs. Adjacent the spine and your fingers stretched laterally. Ask the client to take a breath while you observe the movement of your hands and any lag in movement. So respiratory exertion is the movement of the thoracic diaphragm during the breathing. So Queen, can you inhale and exhale? Okay, one more time. Okay. Now palpated the thorax for vocal primitus, the faintly perceptible vibration. Place the palmar surface of your fingertips of the ulnar aspect of your hand or closed fist on the posterior thorax, staring near the apex of the lungs. Ask the client to repeat such as word, the blue moon, or 1, 2, 3. Repeat the two-step, moving your hands subsequently to the base of the lungs. Compare the primitus on both lungs and between the apex and base each lung to assess for increase or decrease of lung density. So now, Queen, I want you to say the blue moon as I'll palpate your posterior thorax. Okay. Now, let's percuss the posterior thorax. Ask the client to bend the head and fold forwards arm across the chest. Percuss the intercostal space about 5 to 2 cm intervals in a systematic sequence. Compared one side of the lung with the other. Percuss the lateral thorax every few inches, starting to the axilla and working down to the atrium to assess for lung resonance. So now, Queen, I'm going to percuss your posterior thorax. Okay. So now we're going to measure the diaphragmatic exertion. Use percussion to identify the level of the diaphragm and measure diaphragmatic exertion. Percuss downwards from above the expected level of diaphragmatic dullness until dullness is definitely heard. So mark the level of expiration. Had the patient inhale deeply and hold it in. Then percuss downward to the level of dullness of full inspiration and mark it. Refer this process on the other side. Measure the distance between the expiration and inspiration levels of dullness. So let's now proceed to the measurement. I'm going to write something on your mark on your back, Queen. So can you inhale and then hold it for me? Now inhale. And then can you hold it for me? Now inhale. Can you hold it for me? Now to the other side. So now we're going to auscultate for breath sound. Place the diaphragm of the stethoscope firmly and directly on the posterior chest wall. Ask the client to breathe deeply through the mouth or for each area of auscultation. We will do this procedure by using the flat disc diaphragm of the stethoscope as it's best for transmitting sound with the high pitch breath sound. And we will use the zigzag procedure to assess airflow through the airways. So, Queen, can you inhale and exhale for me as I say so? Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Okay. Auscultated breath sounds, brocophony, asks the client to repeat the phrase 99 while auscultating the chest wall. Egophony, asks the client to repeat the letter E whilst listening over the chest wall. Whisper pectorally Gaia, asks the client to whisper the phrase 1, 2, 3 while ausculting the chest wall. So now, Quint, I want you to say 99 as I check your chest wall. Okay? Okay, now say E. Okay, now I want you to whisper 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. Thank you. Now for assessing the anterior thorax, inspected breathing patterns, inspected the costal angle and the angle at which the ribs enter the spine, and then various respiratory patterns, sublocalizing significance in the patient with altered consciousness to evaluate expansion of thoracic scale. So now, Queen, I will be touching your chest, and can you inhale and exhale for me, please? Okay. So now we're going to palpate the anterior thorax. Using your fingers to palpate for tenderness and sensation, start palpating with your hands. Position over the left clavicle. Move your head left to the comparing findings. Move your hands symmetrically downward toward the middle line at the level of the beats and outward of the base. Include the lateral aspect of the lung. Repeats the sequence of palpating for crepitus primitus in the anterior thorax. Once again, I will be touching your chest, Queen, okay?
Fingers.
So now I'm going to palpate the anterior thorax for respiratory exertion. Place the palms of both your hands on the lower thorax with your fingers laterally along the lower rib cage and your thumbs along the costal margins. Ask the client to take a deep breath while you observe the movement of your hands. Respiratory exertion is the movement of the thoracic diaphragm during the breathing. So, Queen, can you take a deep breath for me, please? One more time. Okay. So now we're going to percuss the anterior thorax mystically. Begin percussing above the clavicle into the supraclavicular space and proceed downward to the diaphragm. Compare the lung on the one side to the lung on the other side. Displace the female breast to facilitate percussion of the lungs. To assess for lungs resonance. So, Queen, I request you to lay on the bed. Now I will start percussing your chest. So now auscultated for anterior breath sounds, adventitious breath sound, and voice sounds. Auscultated the trachea, sculpted the anterior thorax, place the diaphragm of the stethoscope firmly and directly on the anterior chest wall, auscultated from the epiphysis of the lungs, slightly above the clavicle to the base of the lungs to the 8th to the 6th rib. Ask the client to breathe deeply through the mouth in an effort to avoid transmission of sounds that may occur with nasal breathing. Listen on each side for at least one complete respiratory cycle. Listen for normal breath sounds and adventurous breath sound. Follow the systematic ladder pattern to assess airflow through the airway. So let's us proceed to the procedure. So Queen, I invite you to sit, please. So I want you to take a deep breath from your mouth. Okay. 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 Thank you. So now we are going to summarize the information obtained during the working phase and discuss the findings to the client. Discuss to the client possible plans to resolve the health concern 8%. So now, ma'am, I will be reading the finding from our assessment. So, surveying chest and respiration, no respiration distress or problems with your oxygenation. For the examining posterior thorax, your spine is symmetrically aligned spinal. The column is slightly bent, right and left. Shoulders and hips are at the same height. Your skin is intact and temperature is uniform. So for the respiratory exhaustion, full and systematic storage and function. Then for the thorax, vocal firmitude is bilateral symmetry of vocal formation and is heard clearly. For your percussion, ma'am, normal for it, resonates, expect over the scapula. For the diaphragmatic exhaustion, the vesicular and vesicular breath sound is okay. So the oscillate breath sound, quiet rhythm, and effortlessly respiration. So for your anterior thorax, full systematic. And about for your percussion, resonant sound, disease rib over the area. For the osculating anterior thorax, it is adventurous breath. So now assess for client's understanding of the plan and need for the further teaching, provided the client the opportunity to clarify or ask any concern. Do not forget to exercise Queen and stay healthy all the time. So do you have any clarification, ask some question, or may raise a concern?
Okay.
Okay, so thank the client and ended the interview politely. Done aftercare, perform hand washing, documented findings in the client record using printed or electronic forms or checklists supplemented by narrative notes when appropriate. So, Queen, thank you for your cooperation and thank you for your time and effort. It's my pleasure to help you.